With a 29% week-on-week increase in positive cases, the province is firmly in the grips of the third wave. Over 170 people are hospitalised every day in the Western Cape, and this number is expected to rise exponentially in the coming weeks. The current combined use of oxygen now stands at 47 tonnes daily in the private and public sectors. Non-emergency healthcare services have been scaled back at public facilities, and field hospital beds have now also been reactivated.
Our COVID intermediate care, our Brackengate Hospital of Hope, that we've now brought online, and in light of our triggers, they currently have 133 patients. They have the capacity to go to 338. Mitchells Plain Hospital of Hope, which can go to 200 people, has currently got 47, and Soonstraal has got 39, and we're looking at bringing additional capacity online at Soonstraal as well. There are other beds that still needs to be triggered, and we all have this capacity that we can trigger as the need goes forward.
Private hospital group Mediclinic has reported increased admissions with a high demand for beds and ICU resources in most provinces. Melamed meanwhile says it's coping with the current COVID admissions.
We do have 4 hospitals in the Western Cape, so should we reach a situation of capacity in one hospital, we can always transfer to another hospital. Non-COVID procedures or medical requirements are still open, and then of course if there are surgery required, it will be up to the specialist doctor to confirm if they're able to accommodate for the surgery.
Authorities are expecting an extension of the current level 4 restrictions, but say it will be a fine balancing act between saving lives and livelihoods.
I cannot believe that we have one size fits all across the whole of South Africa, where KZN is not even in the third wave technically as yet. And of course, Gauteng at the peak of the third wave, the Western Cape numbers climbing. We need to make sure that we are dealing with the balance correctly between regions across our province and across our country, making sure we have sufficient health response, that being frontline workers, that being beds, that being oxygen, making sure that we've got our field hospitals up and running.
The province is expected to reach the peak of infections by the end of July to the first week in August. Vanessa Puna, SABC News, Cape Town.